Dr. Taketa-Wong, thank you for joining us today for the second of our two-part series. I'm here with Dr. Lauren Anderson, who is joining us today to share some of her clinical knowledge and expertise and wisdom. Conventional medicine looks at most everything typically through the lens of drugs and surgery. And that's what it's great at when it's needed, and I have no problem recommending it when it is needed. However, when it comes to things like PMS, menstrual cramps, migraines, and other symptoms related to women's health, we're not looking at a disease. We're looking at a body, organs, hormones, blood vessels that are out of balance. And the goal is to bring that body, that individual, back to a healthy balance. Today we're going to be talking about how naturopathic medicine typically treats PMS, menstrual cramps, and migraines, and we're going to be sharing a case history with you today from Dr. Anderson's experience. If you have any comments or questions, please go ahead and put that in the comment section as we go along, and we will make sure to address that and answer your questions today. Now, for those of you who are new to our events, both Dr. Anderson and I are naturopathic physicians, or NDs. Like medical doctors, we attended a four-year medical school. We're trained as primary care physicians, so we order lab tests, write prescriptions, and do school physicals the same as any other doctor. But with naturopathic medicine, there's much more because we NDs are trained to place nutrition at the forefront of diagnosis and treatment. And this is especially true when it comes to women's health. Now it amazes me, but even today, fewer than 20% of our medical schools require any courses in nutrition. Of those, the offerings are typically fewer than 25 hours in 4 years. By contrast, naturopathic doctors typically receive 155 hours of training in nutrition to really look at the power of nutrition to build health from the inside. Applying that knowledge to a patient's condition, whether it's autism or PMS, takes a lot more time than just prescribing pills. So our office visits are a full hour for that reason. In addition, I'm also a licensed acupuncturist and trained in Chinese medicine, which also gives another powerful natural medicine tool. And as you're viewing this and want to talk with me or Dr. Anderson, just call or text our office to schedule a free phone consultation. There's no charge because we don't take patients without talking to them first. We always want to make sure that what we do is going to fit your needs. You'll find all the contact information on our Facebook page, and you can also click on the link in the post. And just as a reminder, please feel free to use the comment section to ask questions as the talk progresses. So I do want to welcome Dr. Lauren Anderson to our conversation, and she's going to be sharing some of the details of her approach with a specific case. And again, thank you, and thank you for joining us, and good to be with you again, Dr. Anderson. So
Thank you for having me. Good to be here.
And so I just wanted to start out by talking with you or asking, when you're approaching the case of a woman who comes to you where she's having, and I know you have very extensive experience with this, in terms of working with a woman who has PMS, mood issues, menstrual cramps, menstrual migraines, some women may have breast tenderness or a lot of fatigue during their period. So what is the general approach that you take when you're starting to work with patients like this?
Well, I think the first thing I need to learn about is their lifestyle. That has a really big impact on our hormones and ultimately hormone imbalance. So I'm going to be asking them a lot about their diet, whether or not they exercise. Of course, we're going to be running lab tests to see where everything's at, either in the blood or through the saliva. Yeah, I think those are the main things and stress and sleep are another, big thing that need to be looked at, just like they do with any other condition that we treat. Right, Catherine? It's always those foundational things, ultimately, that are going to help someone heal whatever is imbalanced in their body, versus just treating the symptoms.
Yeah.
But we can do that too with natural medicine. And that's actually the other piece to the approach. I think whether someone's coming to us for, women's concerns or any other symptoms, we're going to do what we can right away to get them out of discomfort and treat whatever symptoms they have, preferably with natural medicine, right? That's what we like to use. And the great thing is we have so many awesome tools for that acute. So, things like acupuncture, great for pain, herbs, antispasmodic herbs. So yeah, that's my kind of overall approach. I can give some more specifics when I talk about the case.
Yeah. And I know that a lot of times there tend to be hormone imbalances, with these kind of cases. So could you talk a little bit about some of the hormone imbalances? Like, what's an example of a common, or some common hormone imbalances that you might see that could cause these kind of symptoms or conditions?
And the case I'm going to share, I'll share that particular patient because it is very common. This is a gal in her 30s. And what we often see is something that is referred to as estrogen dominance. And most people would think that means maybe you're overproducing estrogen, but it's often not. It's actually a relative deficiency of progesterone causing there to be estrogen dominance. And that can lead to a lot of the symptoms that people experience, especially with specifically what we're talking about, with PMS, menstrual cramps, migraines. And then the other piece is, so it's the estrogen dominance often coupled with a progesterone deficiency. And then we look at other hormones as well, especially the adrenal hormones. So many women, including the case that I'm going to talk about today, she has hormonal acne. And what we discovered was that her DHEA, which is a hormone produced by the adrenals, typically in response to stress, was high. And what can happen is your body can convert that into a form of testosterone that increases acne. So it's really, you have to look at the whole picture, but all of those are actually, all three of those that I spoke about are really common. And I'm sure you see them often as well.
Yeah.
And they really do tend to go together in that age group. I notice a lot of women in their, teens, 20s and 30s with significant hormone imbalance,
Yeah, definitely. And then one thing that I think isn't talked about as much in conventional medicine, but that we do talk about in naturopathic medicine, is the liver and the role of the liver in some of these conditions like PMS and menstrual migraines and things like that. So could you share some insights into what you see the role of the liver being in situations like this?
Yeah. Well, let me start by the way that because a lot of people know that the liver has to do with detox, but what does that really mean, right? And so our liver is responsible for taking basically anything from, a drug that we take in to our hormones and metabolizing them, meaning the liver breaks that down into pieces that your body can either use or excrete. So the liver plays a big role in hormone metabolism. And if the liver is overwhelmed, say by other toxicities or a poor diet or stress or all of those things, then the metabolizing of the hormones is going to be affected as well. So whenever we treat the liver, or whenever we treat the hormones as far as balancing them, we always treat the liver as well.
Yeah. Yep. And I think that's a piece that many people, haven't heard about or don't know about. And that I think that's something that's a big part of what we do in terms of naturopathic medicine with treating it. And I know you mentioned...
I mentioned one more thing too. Yeah. Just before I forget, I was going to say that what I think often gets missed, and I'm sure you would agree, is that you have women who are having hormone imbalance. They're already aware pretty much of all these things we've talked about, right? And they're doing the hormone balancing herbs and everything. But if they're not getting better, there's often an underlying toxicity that needs to be addressed first before the body can get back into balance, even with the support from the herbs. And that's really, I think, where it's digging down to the one down and then continuing going down and down, finding those true root causes.
Yeah. And I think that like when you mentioned toxins, I mean, there's so many things that we've seen, I know with both you and I, with our patients. I mean, I know that I've seen patients with issues with heavy metals, like with mercury or lead, or other kinds of toxins, because we can do tests that sometimes find that, there's high levels of toxins from pesticides or herbicides. Could be mold toxins.
Super common. Mold is so common.
Yeah, especially in Hawaii, but not just limited to Hawaii though.
No, nope.
Mold is so much more common than people realize.
Well, because often if it's chronic and it's systemic exposure, you might not even have any respiratory symptoms. So a lot of times it just completely, is not in a person's line of sight to even think about it.
Yeah.
I just treated a whole family with mold and none of them had respiratory symptoms. Like not, a lot of people, and it presents a lot different in kids than adults typically too.
Yeah.
As far as this, right? Some patients will just have abdominal symptoms. Like, who would think of mold for that, right?
Right.
And the case that the case we're talking about, the interesting thing about her history, and that's another thing we always include in our intake, which I think is very important, is history of environmental exposures. And this particular patient grew up on a farm. So, things like the pesticides and herbicides, things like Roundup, glyphosate, we tested for that, and she was high in that and treated that. So these are significant, especially the toxicities with hormones.
Yeah. And the last piece I wanted to touch on before we share the cases is nutrition. And most women don't typically think about their food and their nutrition as being something that can really play into what they're experiencing with PMS and menstrual cramps. And I think a lot of women think, okay, I mean, I crave sugar and chocolate around my period, but they don't really think about things beyond that. So, and with your expertise, of course, you worked as a dietitian for 15 years before you became a naturopathic physician, so you have very extensive training and experience with that. So, with that, can you share just a short little thing into the role of nutrition and how you see that playing into things like PMS and menstrual cramps? And menstrual
I think
migraines?
There's a lot that you can say about this subject, but if I had to choose probably the most important things, many women eat what we call a standard American diet, which is high in sugar and inflammatory. So that's a key piece of the puzzle. If you've already got a lot of inflammation going on in your body, right? Every month when you have your cycle, it's like just throwing more fuel on the fire. The other big thing that's very important that I always teach my students about is, when I teach nutrition, you have to understand that nowadays the amount of hormones, not just toxins, but actual hormones that are in our food supply is significant. So in things like conventional dairy and agri-industry meat, and that means cows that were fed like corn and not grass, and given antibiotics and growth hormone and all that stuff. That's so significant that women, or girls, I should say, are now getting their period, 3 to 4 years earlier than they did even when you and I were younger. It's
Right.
like it has changed, and they attribute that primarily to the hormones in the food and, of course, the toxins in the environment as well. So I would say, that those two things really predispose somebody to hormone imbalance. And then couple that with, if you're eating a standard American diet and you're eating a lot of sugar and you're consuming too many calories and not moving your body enough, and you accumulate fat around your belly that we refer to as visceral fat, that fat actually contains contains, it will take certain hormones and cause them to change into other hormones. It's a hormone called aromatase. So it'll actually, like in a woman, it can happen in a man or a woman, but in a woman, it'll take the estrogen and convert it, and progesterone, and convert it into testosterone. And it'll do the opposite in a male. So the diet too connects in that way. So if you're overweight, especially the belly weight.
Yeah, yeah. And it's such a huge piece that is often, I hate to say it, but is often really dismissed in conventional medicine, because most of these women, when they go to the OBGYN, really the only, I think, treatment option that is really presented to them is hormones, birth control. And that's it, and it's not, unfortunately, really looking at all these different possible underlying causes or contributing factors. So,
Yeah.
and often they're prescribed that without even testing their hormones to know what is out of balance in the first place anyway. So
Right.
yeah. And for our audience, what's important to remember while we're discussing these important topics is that our patients and we are in a partnership for health, and that means that they learn how to make the healing changes that will lead to successfully treating their condition. I mean, they learn how to feel more energetic and enjoy more happiness. And the natural medicine approach that we use often includes medical grade supplements rather than drugs. So, if you're looking to purchase supplements, especially ones that help to forward your health, it's really important that they are tested for quality by independent laboratories. There's no FDA regulation for herbs and supplements. And many that are on the market can be tainted or use cheaper ingredients. So I invite people to visit our online supplement store. It's the only one where all the products meet the highest quality for standards, and 100% of the proceeds go to help with medical treatment for autism and special needs patients. And in addition, you'll also receive 20% off of the regular prices, so it's a win-win relationship. You'll find it at drtaketa-wong.com. That's drtaketa-wong.com, and you'll find the link in the post with this video. So going on with the case, that you shared, could you share with us a little bit more about that case that will give people a little more insight into how we treat PMS, menstrual cramps, and migraines?
Yes, absolutely. So just a little recap. 32-year-old female, and her main concerns were hormonal acne, hormonal migraines, menstrual cramps, and insomnia. Those were her primary concerns when she first came to see us. And the PMS and the menstrual cramps were somewhat debilitating, where every month she would have to take time off of work often if her period didn't fall over a weekend. And so if a patient comes to us, even though we are always going to use our naturopathic approach and work long-term to heal and balance the body, we needed to address her symptoms right away. And based on lab testing, her progesterone came back extremely low. So in this particular case, I did actually use a very low dose of bioidentical progesterone right off the bat. The cool thing about progesterone is it helps you sleep. You usually take it at bedtime, so it helped with her insomnia. And it almost immediately started helping to balance that estrogen and progesterone out. So it's not just about your total numbers, it's about how much estrogen and progesterone you have into relationship with each other. I always say it like it's like if estrogen is the grass, progesterone is the lawnmower, right? And if you cut the grass too short, the grass dies. If you let the grass get too long, it gets unruly. So if estrogen is allowed to circulate around the body unchecked by progesterone, that's when it has its negative effects. Not only, right, PMS symptoms, but potentially long-term, right? Things like if you're sensitive, or like something like developing a hormone sensitive cancer even.
Yeah.
So let me circle back. So we used bioidentical progesterone for her that helped with the sleep as well. Acutely, I gave her, we referred her to an acupuncturist for treatment, to treat her menstrual cramps, and also to start balancing the energies and the hormones. some other things that I love for menstrual cramps that we did for her there's some great, we call them anti-spasmodic herbs.
Mm-hmm.
One of the probably most popular ones is called cramp bark, which
Mm-hmm.
makes sense. But there are some others that I love that are even a little bit stronger. Kava kava is good, and
Mm-hmm.
Pisidia, Jamaican dogwood, is good too. If you need kind of a more, but Vitanica makes the cramp bark extra, which does pretty well for a lot of people. Um, I also am a huge fan of magnesium.
Mm-hmm.
So in the
Yeah.
short term, we actually did a nutrient IV with high amounts of magnesium leading up to her cycle to see, and that really helped her a lot.
Mm-hmm.
And then so these are the things that we're going to do short term, still natural, but getting you immediately out of pain without having to reach for the painkillers and things like that. As we began to work on figuring out the toxicities, treating those with some of my favorite things that we did with her is infrared sauna.
Mm-hmm.
And just sweating is one of the best ways to get toxins out of your body. And
Mm-hmm.
not everybody can get in the gym and get a good sweat on every day, so things like infrared sauna are a great option, or even a warm Epsom salt bath. And then combine that with binders, things like activated charcoal that can help to bind up the toxins as they're being released.
Mm-hmm.
We did all of that, and then we did a combination of hormone balancing herbs. The primary one being Vitex.
Mm-hmm.
Vitex is a great herb for helping to help especially in a younger female, right, who's not making a lot of progesterone. It's going to help her make more of her own progesterone. So those hormone herbs we combined with what we call adaptogen herbs for the adrenals to help balance that stress response out as well.
Mm-hmm.
Yeah, I think that and that we focused on the diet, all similar things that we spoke about before. I encouraged her to begin doing resistance training, which was really helpful for her. And I also really encourage it for hormone balancing in women. And the other thing I want to mention that we haven't talked about yet is a word called xenoestrogens. So xenoestrogens are things in the environment that we can take in our body, that we can breathe in, that we put on our skin, that mimic estrogen in the body. So when you have these estrogen dominant conditions, you can try to avoid these things to help decrease that estrogen dominance, essentially.
Yeah.
And so an example would be plastic water bottles.
Mm-hmm.
Those are a big one. A lot of the skincare products that we use have ingredients in them that act as estrogens. So that I think the one other thing that we did long term that helped, that I love, is seed cycling as well. Using certain, like flax seeds, chia seeds, pumpkin seeds, and those seeds actually help to balance the hormones, and you use them in conjunction with the moon cycles. But again, that's someone who's having debilitating menstrual cramps, where they have to take time off work, and bad acne, migraines, all of that. Seed cycling is not going to get them relief, right? It'll help balance their hormones long term, but you need to do some more intensive naturopathic treatments. And for migraines, the other thing, and for cramps, hydrotherapy. So one of my favorite easy for migraines, especially because migraines are vascular, right? So you want to try to pull that congestion down away from the head. So if you put your feet in warm water and you do a cool compress at the base of the neck, or even like, I don't know if you've ever seen these, Dr. Taketa-Wong, but they have those gel and it's like a full helmet.
Oh, uh-huh.
Those are wonderful for migraines, whether your feet are in or out of the warmth. But basically you want to, that is an example of hydro, and we're using temperature to control blood flow in the body. And we're pulling all of that congestion down away from the head. And feverfew is another herb that I love for hormonal migraines specifically, which is what we put her into.
Yeah. So that's great. And then, can you tell us what happened with her?
So I would say we got her off the bioidentical progesterone about 3 months. I usually put people on it for about 3 months because that's about how long it takes to kind of get the protocol rolling, get the lifestyle stuff happening. And, when you take herbs, you have to remember it's not like taking a pain medication or, allergy medicine is always a good example. When you use herbs for allergies, you can't take one dose and expect it to clear everything up, right? You have to take it consistently. It's the same with this. You have to take herbs usually for, I always say at least to give it a good 4 weeks or get through the first bottle before you make any decision, at least about if it's helping or not, right? But at the 2-3 month mark, you're usually, right, really starting to notice some good changes. So yeah, she eventually was able to go off the progesterone. The stress sort of continued in her life, so we kept her on, the adrenal support and some hormone balancing, so she wouldn't end up back where she was. But yeah, she got to the point where she lost weight, and she wasn't having to take time off of work. She would get a little bit of cramping here and there, but we were able to manage it with things like magnesium at home, or like warm rice pack, cool, warm compress, things like that. So yeah, her symptoms significantly improved.
Yeah, nice. And her acne, did that resolve?
Oh yes, yes. That was a little bit more resistant, as it often is. And so that is often related to the hormone imbalance and the toxicities. So when that didn't clear up initially, as we continued to work together, we really focused in on the sweating regularly, the movement, moving the lymphatic system, all of the dry brushing, all of that to really, yeah.
Yeah, no, that's great. So, and it's just so rewarding when you see a patient. I know that's why you and I are doing what we do. It's just so amazing and so rewarding to see a patient getting better with natural medicine and not having to depend on pharmaceuticals and having a better quality of life. And they, it can just turn their whole life around, because when they're in pain and they're not feeling good, that can affect their relationship with their significant other, with their work, with their kids. It can affect so many facets of their life, and to be able to see that turn around and their whole life can change, it's just so amazing to see that and be a part of that. So yeah.
Yes.
Nice. So, I just want to thank all the viewers for being here with us today. There really is more value to our treatment protocols than finding and addressing the underlying causes of disease. When you really think about it, the naturopathic approach, it's a way of empowering people. And, we assist them in understanding what's happening in their bodies and why. And, we can help them use this knowledge to be able to take greater command of their own health and well-being. So I think the big take-home message for today is that PMS, menstrual cramps, menstrual migraines, and many other symptoms that can accompany the menstrual period, they can be treated without resorting to hormone therapy or pain medication. And we emphasize that the naturopathic approach first tests to determine the causes for each person's individual condition, and then we prescribed an individualized protocol to treat those causes. So I trust that our discussion about women's health for our viewers has been useful to you. If your doctor doesn't have the time to educate you like we're doing here today, you're welcome to talk with us personally about any health concerns that you have, so that you too can feel empowered with your health. To do so, just call or text our office to schedule a free phone consultation. There's no charge, because we don't take patients without talking to them first. We always want to make sure that what we do is going to fit your needs. And again, you'll find all the contact information on our Facebook page. Mahalo again to Dr. Anderson, and for our viewers, we look forward to seeing you again in 2 weeks. Aloha.
Aloha.